Haemopoiesis quiz. In the early weeks of gestation, the yolk sac plays a transient role in which of the following processes? A. Respiratory development. B. Digestive enzyme production. C. Haemopoiesis. D. Neural tube formation. E. Limb bud development. Answer. C. Haemopoiesis. Definitive haemopoiesis originates from stem cells first observed in which region during development? A. Aortic gonads mesonephros, AGM, region. B. Yolk sac. C. Placenta. D. Liver. E. Spleen. Answer. A. Aortic gonads mesonephros, AGM, region.
Question 3. From 6 weeks until 6 or 7 months of fetal life, which organs are the major haemopoietic organs? A. Liver and spleen. B. Yolk sac and bone marrow. C. Bone marrow and thymus. D. Placenta and liver. E. Spleen and bone marrow. Answer is A. Liver and spleen. Question 4. From 6 to 7 months of fetal life, which site becomes the most important for haemopoiesis? A. Bone marrow. B. Spleen. C. Yolk sac. D. Liver. E. Thymus. Answer is A. Bone marrow. Question 5. In normal childhood and adult life, which structure serves as the sole source of new blood cells? A. Liver. B. Spleen. C. Thymus. D. Bone marrow. E. Lymph nodes. Answer is D. Bone marrow. Question 6. During infancy, what is the characteristic feature of bone marrow, compared to childhood? A. It is predominantly fatty throughout childhood. B. It undergoes rapid haemopoietic decline. C. It exhibits progressive fatty replacement in long bones. D. It remains primarily fibrous throughout childhood. E. It experiences an increase in red blood cell production. Answer is C. It exhibits progressive fatty replacement in long bones. Question 7. In adult life, where is haemopoietic marrow primarily localized? A. Throughout the entire skeleton. B. Only in the cranial bones. C. Exclusively in the ribs and sternum. D. Confined to the central skeleton and proximal ends of the femurs and humeri. E. Mainly in the distal extremities of the limbs. Answer is D. Confined to the central skeleton and proximal ends of the femurs and humeri. Question 8. Haemopoiesis initiates with a pluripotential stem cell that possesses the ability to A. Only undergo symmetric cell division. B. Produce only red blood cells. C. Self-renew through asymmetric cell division. D. Differentiate exclusively into a single cell lineage. E. Regulate immune response without differentiation. Answer C. Self-renew through asymmetric cell division. Question 9. Haemopoietic stem cells, HSC, demonstrate the capacity to repopulate a bone marrow that has been depleted of all stem cells due to lethal irradiation or chemotherapy, highlighting their A. Limited regenerative potential. B. Sensitivity to radiation exposure. C. Inability to differentiate into multiple cell lineages. D. Resistance to chemotherapy agents. E. Remarkable regenerative and self-renewal capabilities. Answer is E. Remarkable regenerative and self-renewal capabilities. Question 10. The haemopoietic stem cell, HSC, is notably rare, estimated at approximately A. 1 in every 1 million nucleated cells in the bone marrow. B. 1 in every 5 million nucleated cells in the bone marrow. C. 1 in every 10 million nucleated cells in the bone marrow. D. 1 in every 20 million nucleated cells in the bone marrow. E. 1 in every 50 million nucleated cells in the bone marrow. Answer is D. 1 in every 20 million nucleated cells in the bone marrow. Question 11. Many haemopoietic stem cells, HSC, remain dormant, with studies in mice suggesting they enter the cell cycle approximately every A. 2 weeks, B. 5 weeks, C. 10 weeks, D. 20 weeks, E. 30 weeks. Answer is D. 20 weeks. Question 12. In immunological testing, haemopoietic stem cells, HSC, typically exhibit which phenotype? A. CD34, negative CD38+ and positive for lineage markers, Lin+. B. CD34, negative CD38, negative and positive for lineage markers, Lin+. C. CD34 plus CD38, negative and negative for lineage markers, Lin negative. D. CD34 plus CD38 plus and negative for lineage markers, Lin negative. E. CD34 plus CD38, negative and positive for lineage markers, Lin+. Answer is C. CD34 plus CD38, negative and negative for lineage markers, Lin negative. Question 13. Haemopoietic stem cells, HSC, are typically found in specialized niches, which may be A. Myeloid or lymphoid in origin, B. Endothelial or epithelial in nature, C. Fibrous or cartilaginous in composition, D. Osteoblastic or vascular in nature, E. Muscular or adipose in structure. Answer is D. Osteoblastic or vascular in nature. Question 14. Cell differentiation from the stem cell progresses through committed haemopoietic progenitors, which A. Exhibit unlimited developmental potential, B. Originate from mature blood cells, C. Lack specificity in lineage commitment, D. Are capable of self-renewal, E. Are restricted in their developmental potential. Answer is E. Are restricted in their developmental potential. Question 15. Very early haemopoietic progenitors are often evaluated by culturing them on bone marrow stroma, a method known as A. Differentiation assay, B. Lineage tracing technique, C. Clonal expansion test, D. Long-term culture initiating cells, LTCIC, assay, E. Transplantation assessment. Answer is D. Long-term culture initiating cells, LTCIC, assay. Question 16. Late haemopoietic progenitors are commonly evaluated using which method? A. Flow cytometry analysis, B. Immunohistochemistry staining, C. Long-term culture initiating cells, LTCIC, assay, D. Liquid suspension culture, E. Semisolid media culture. Answer is E. Semisolid media culture. Question 17. The earliest detectable mixed myeloid precursor, capable of generating granulocytes, erythrocytes, monocytes, and megakaryocytes, is referred to as A. CFUE, colony-forming unit erythroid, B. CFUG, colony-forming unit granulocyte, C. CFUM, colony-forming unit monocyte, D. CFUGM, colony-forming unit granulocyte monocyte, E. CFUGEMM, colony-forming unit granulocyte, erythrocyte, monocyte, megakaryocyte. Answer is E. CFUGEMM, colony-forming unit granulocyte, erythrocyte, monocyte, megakaryocyte. Question 18. Where do lymphocytes primarily originate, differentiating from a common lymphoid precursor? A. Spleen. B. Thymus. C. Liver. D. Bone marrow. E. Kidney. Answer is D. Bone marrow. Question 19. Which of the following organs are considered secondary sites of lymphocyte production, besides the bone marrow? A. Liver, pancreas, and kidneys. B. Spleen, lymph nodes, and thymus. C. Lungs, intestines, and adrenal glands. D. Stomach, gallbladder, and bladder. E. Heart, brain, and skeletal muscles. Answer is B. Spleen, lymph nodes, and thymus. Question 20. What characteristic of stem cells ensures the maintenance of constant marrow cellularity in a normal, healthy steady state? A. Differentiation into multiple cell types. B. Limited regenerative potential. C. Sensitivity to external stimuli. D. Self-renewal capability. E. Dependence on cytokine stimulation. Answer is D. Self-renewal capability. Question 21. Approximately how many mature blood cells can one stem cell produce after undergoing 20 cell divisions? A. 10,000. B. 100,000. C. 1 million. D. 10 million. E. 100 million. Answer is C. 1 million. Question 22. What trend is observed with aging regarding stem cells and their progenitors? A. Increase in stem cell numbers and lymphoid progenitors. B. Increase in stem cell numbers and myeloid progenitors. C. Decrease in stem cell numbers and lymphoid progenitors. D. Decrease in stem cell numbers and myeloid progenitors. E. No significant changes in stem cell numbers or progenitor types. Answer is D. Decrease in stem cell numbers and myeloid progenitors. Question 23. Which statement regarding stem cells and aging is accurate? A. Stem cells do not accumulate genetic mutations with age. B. Stem cells accumulate genetic mutations only in specific tissues. C. Stem cells accumulate genetic mutations at a constant rate throughout life. D. Stem cells accumulate genetic mutations, contributing to age-related changes. E. Stem cells accumulate genetic mutations primarily during embryonic development. Answer is D. Stem cells accumulate genetic mutations, contributing to age-related changes. Question 24. What role does the bone marrow play in supporting stem cell function? A. It inhibits stem cell self-renewal. B. It provides an unsuitable environment for stem cell survival. C. It promotes stem cell differentiation into mature cells. D. It hinders the formation of differentiated progenitor cells. E. It forms a suitable environment for stem cell survival, self-renewal, and formation of differentiated progenitor cells. Answer is E. It forms a suitable environment for stem cell survival, self-renewal, and formation of differentiated progenitor cells. Question 25. What components make up the bone marrow environment that supports stem cell function? A. Neuronal cells and lymphatic vessels. B. Adipocytes and cartilage cells. C. Fibroblasts and immune cells. D. Stromal cells and a microvascular network. E. Epithelial cells and smooth muscle cells. Answer is D. Stromal cells and a microvascular network.